I just want to piggyback on my prior post and talk some more about how I believe strongly that every doctor that examines breasts should have an idea of what a normal implant exam and screening regimen should be. So my last video was talking about screening, so patients that are coming in for their annual well-patient visits and making sure they get a proper exam and screening for their implant. But let's talk about if you have trouble with your breasts and are seeing a breast surgeon. Now, my breast surgeon colleagues also need to be very good at evaluating implants, and I have not found that that is the case all the time. So as a breast surgeon, if you are going to the operating room or biopsying a patient that has implants, it's very important that you document the implant exam. And it's very important if you are going to proceed with an operation that the implant is addressed if needed. Something that I see all the time is patients with breast masses, either cancer or benign, who are taken to the operating room with problematic implants, aging implants, and nothing is done to address the implant. This would be the perfect time to do it. And if you have a mass as a patient, things are often covered or more easy to get covered. So breast surgeons, please, if your patients have implants, find out the age of the implants, assess them for capsular contracture, and get a plastic surgeon involved because we can work together to get better care for that patient. I've seen multiple patients this year who had a lumpectomy for breast cancer and were radiated, who had pre-existing implants in place that were over 20 years old with capsular contractures, and it wasn't addressed at the time of their surgery. That is absolutely criminal. Those patients needed other things done than just their cancer care. And although you have now cured their cancer, they have horrible contractures and they're radiated, making it much more difficult to deal with. They really deserve to have options to manage their implant so things could be done at the same time and they would have less pain and better outcomes moving forward. I just find that implants are often ignored by doctors other than plastic surgeons. And this is very unfortunate because problematic implants can be so painful for patients and really lead to decreased quality of life. And they deserve to have these things managed and they deserve the information at a baseline. And I get a lot of pushback with people saying things aren't covered or it's expensive. Possibly so, it often is covered, but you don't get to make that determination for the patient. You should at least try. The patient deserves to have that information and they can make those decisions with you. Don't make those decisions for your patients. They deserve an adequate exam, they deserve a plastic surgeon involved, and they deserve to not live in pain and have bad outcomes if we can prevent that.